Well, hello, everyone, and welcome to our event on the Social Security and Medicare trust funds. We so appreciate you all being here today. I know this is the single most important thing going on in politics or policy right now, and there's nothing else interesting going on. So we very much appreciate all of you tuning in and joining us today for what I hope to be a great discussion. I'm going to start off, for those that don't know me, and I think most of you do, I'm Marc Goldwein. I'm the Senior Vice President and Senior Policy Director of the Committee for Responsible Federal Budget. Just want to make sure you all are seeing my screen. It looks like you are. I'm going to start off by giving some basic context on what we learned on Friday from the Social Security and Medicare trustees. Now, I know most of you have already visited crfb.org and read our not one, not two, but three separate analyses on the trustees report. And so I'm just telling you what you already know. But I am going to break it down to sort of a few simple slides. So first of all, insolvency is in the near horizon. Two of the three major trust funds are projected to be insolvent within the next decade, according to the trustees. The Hospital Insurance Trust Fund, which is Medicare Part A, is projected to be insolvent in just 8 years in 2031. The Old Age Trust Fund is projected, Social Security Old Age Trust Fund is projected to be insolvent in 2033. That's just 10 years from now, when today's 57-year-olds are reaching the normal retirement age, when today's youngest retirees are turning 72. Now, we could reallocate money from the Disability Trust Fund, which is actually in pretty strong shape. That would extend the Old Age Trust Fund's insolvency from 2033 all the way to 2034, 11 years from today. This is relatively similar to last year's projections. The Social Security Retirement Fund is in somewhat worse shape. We'll talk about why in a bit, but it largely has to do with the very high COLA they just had. The Disability Trust Fund's in somewhat better shape. The Medicare Trust Fund is in somewhat better shape. But overall, very similar picture to what we saw last year. When it comes to Social Security, sorry, I'm just making sure y'all are seeing the right slides. But when it comes to Social Security, the problem is spending is well in excess of revenue. Since about 2010, we've been spending more on benefits than we've been bringing in from payroll tax revenue. It's been up and down because of various economic crises, but overall it's been growing, and it's projected to continue to grow as more of the baby boomers retire and we get older. In 2034, assuming that reallocation, that will cease to be true because the law says we cannot pay more than the trust funds have in reserves. And so in 2034, the law says, assuming we reallocated, there'd be an across-the-board 20% benefit cut. By the way, if you ever say, I'm not touching Social Security under any circumstance, you're endorsing a 20% or 23% across-the-board benefit cut in 10 or 11 years. Now, overall, the problem is large but manageable. The solvency gap is about 3.6% of payroll, which basically means if we were to immediately raise the payroll tax rate from 12.4% up to 16%, that would just about assure us 75-year solvency. Now, that number is artificially low because we have a trust fund right now. So if you were to say, look at a given year at time, that gap gets as large as 5% of payroll, and it's still 4.5% by the end of the window. So ultimately, you need to raise that payroll tax rate a little bit more. As I mentioned, the Social Security situation is worse than last year. That's mainly driven by the fact that we had an 8.7% cost of living adjustment. The trustees were projecting less than half that. And while that was driven by higher inflation, that higher inflation largely ate into wage growth rather than pushing up wage growth. And so what we saw was benefits costs went up without revenue going up by nearly as much. There are a bunch of other factors as well that are largely offsetting. In terms of what it would take to solve it, I mentioned you could do the equivalent of raising the payroll tax rate to 16%. That'd be a 28% tax, 20% tax increase, excuse me. If you wait 10 years, it's about a 33% tax increase. By the same token, if you were to cut all benefits today, a 21% benefit cut would suffice. If you wait 10 years, it's about a 25% benefit cut. If you want to exempt current beneficiaries, you could either cut all benefits for new beneficiaries by a quarter today, or wait to 2034, then you're completely screwed because even eliminating new benefits would not get you to solvency. Medicare is in a similar situation as Social Security, somewhat better in part because we have laws in place that actually are containing hospital payment growth, and the revenue source for Medicare because of the surtax is actually rising. It's not flat. Still, Medicare faces a significant solvency gap. In 2031, benefits would have to be cut, or payments would have to be cut by about 11%. That would grow to almost 20%. And while under current law, the trustees project, if we went up to 2100, the program would get back into balance-ish. That counts on us being able to pay hospitals less than their costs. And the actuary has put forward an alternate scenario that looks not very pretty. By the way, Medicare Part A, that's just one part of Medicare. Medicare Part B is actually the fastest growing part that covers physician services. Medicare Part D is also growing, although thanks in part to changes from the Inflation Reduction Act, that growth it looks like it's going to be a lot slower than we previously thought. One thing I have to mention, because we talk about it all the time, is even though we focus on Part A, Part B, Part D, this year officially half of seniors are not in any of them. They are in Medicare Advantage, an alternative private plan. Since Medicare Advantage is now the majority of Medicare, I think we need to get out of the mentality of thinking just about changes to the benefit design and the payment schedule, and also thinking about the Medicare Advantage plan itself and how we're reimbursing them. Well, even though Social Security's outlook is somewhat worse, Medicare's is somewhat better, in part for the same reasons. Inflation doesn't have quite as large an effect on Medicare costs because not everything is indexed. And we had much lower spending in 2022 than expected. While it's good news that we have a couple of extra years for Medicare, overall the clock is ticking on all of these programs. Within a decade, 3 of our nation's 4 major trust funds will be out of money, absent legislative change. And hopefully that legislative change will come about. And this next panel is going to talk about what it may or may not and should include. So I want to introduce my colleague, Josh Gordon, who's then going to introduce that panel. Thank you all.
Hello, everyone. Thank you for being here. My name is Josh Gordon. I'm the Director of Health Policy here at the Committee for Responsible Federal Budget. I also help run our Trust Fund Solutions Initiative. I'm going to introduce our panelists and give them each a chance to speak about either the Social Security or Medicare Trust Fund and the trustees reports. Then as a group, we'll have a discussion and we will be answering audience questions. So please submit your questions through Zoom's Q&A feature, and we will get to them as we go through our discussion. I'm going to introduce the 4 people, and then I'll have our first speaker turn on his camera and we'll get started. We have joining us today Andrew Biggs, who is a senior fellow at the American Enterprise Institute. Kathleen Romig is a director of Social Security and Disability Policy at the Center on Budget and Policy Priorities. Richard Frank is the director of the USC Brookings Schaefer Initiative for Health Policy. And Joe Albanese is a policy analyst at the Paragon Health Institute. We will be starting with Andrew.
I think I cannot turn on my video. I think you guys are controlling that. There we go. Can you all hear me? I sure hope so. Well,
yes.
Great. Well, thank you very much for asking me to speak today. And thank you to Mark for doing such a great summary of the trustees report, which makes my life much easier. I really just want to talk about 2 sort of qualitative points. And when we think about Social Security, one thing I like to say is, if you read a New York Times article on Social Security from 1990 or so, you'd pretty much understand how things are playing out today. Not that much has changed. Obviously, the underlying driving factor behind Social Security cost growth is demographics. If you go from 5 workers per retiree, as we had in the 1960s, to 2 workers per retiree, which is sort of what we're looking at for the long term, the cost of Social Security benefits per worker rises by a factor of about 2.5. So, instead of looking at, an 8% payroll tax rate, you're looking at something like a 20% payroll tax rate. And so it just the demographics drive that. The issue, though, the policy issue, I think, facing our leaders, facing policymakers, is the growth of the real value of benefits. If you look at a new retiree today, they're getting a Social Security benefit that's about 1/3 higher than a person retiring 20 years ago received, even after inflation. So it's 1/3 higher in terms of purchasing power. And under the current benefit formula, that's going to continue year after year into the future. And that's a big factor for why the system is getting to be more expensive. Similarly, the trustees report for this year shows the maximum benefit for somebody retiring at the normal retirement age this year is about $43,000. That's not for a couple, but that's for actually a single retiree. Just for context, the poverty threshold for a couple is about $21,000. So we're going way, way beyond a pure safety net program here. We're looking at a retirement program for middle income and upper income people. Just for context, the maximum Social Security benefit paid out this year is 2 to 3 times higher than what countries like the UK, Australia, or Canada pay. That's a policy choice that we've made. The same is basically true for Medicare. We think of Medicare costs in terms of the number of beneficiaries and the cost per beneficiary. And ordinary people think of cost per beneficiary in terms of healthcare inflation. How much does it cost to provide that MRI or drug or procedure? But about half of the cost, or half the increase in the cost per beneficiary, isn't healthcare inflation per se. It's what the trustees call volume and intensity. We're simply using more of those procedures. We're using more healthcare. Other countries think affirmatively, about how much they're going to provide to people, whether it's pensions or healthcare. We don't think very much in those terms, because people start talking about, seniors eating cat food or death panels or whatever. And by people, I mean members of Congress who really should know better on this. What we need is a more mature discussion of the trade-offs we face. But so far, we're simply not getting that. And that's really a big failing of our political system, not just today with today's politicians, but really over the last 40 years, during which time we've kind of known all of the issues facing entitlement costs and the types of choices that we face. That leads me to my second point, which is the cost of waiting to fix Social Security. Kathleen and others have noted, totally accurately, that even with the trust fund trustees showing the trust fund exhaustion date moving up by 1 year, and the long-term deficit increasing a bit, we still have 10 years to get on top of things. So that's correct. And I don't want Congress to be making policy while it's in a panic, but I'm afraid that's what we're going to get. It's easy to look back at the 1983 reforms and say, well, those worked out at the last minute. So if necessary, we can do that in 2034. But what most people don't know is how much smaller the problem was in 1983 and what we'll be facing the 2030s. If the trust fund had run out in 1983, beneficiaries would have faced cuts of about 4%. It would have lasted for about 6 years. After that, the program would start coming back into surplus and remained so for several decades. Come 2034, we're looking at cuts of 25% that will continue forever. So it's a multiples larger problem. And it's much harder to solve because the 1980 reforms already used up some of the easier options, like increasing the retirement age, raising the tax rate, or taxing benefits. So we get left with the harder options. I'm increasingly worried about how all this will play out, given the lack of seriousness I see among many of our national leaders. Even now, Social Security is primarily being used as a political weapon, not a crucial program for Americans that we should come together to fix. We need to change that, or I do worry we're facing a pretty significant problem in the future. And I'll leave it at that. Thank you.
Kathleen?
Sure. Hello, everyone. Well, I'm going to start by making a confession, which is I'm pretty tired of the Social Security trustees report. This is no criticism of the Social Security trustees or for the hardworking SSA actuaries who put it together. They do a wonderful job. And in fact, they work every year to make the estimates even better. It's just that, like Andrew said, the report basically says the same thing every single year. I still pore over it every year. I've done that 20 years now, but it's told a consistent story the whole time. So I'll just, Mark did a great overview, but I'll just kind of talk a little bit more about the highlights of the report. So starting with the reserve depletion date, and let me make sure I can share my screen. Okay. Sorry about this, 1 second. Okay. Sorry, I'm not great at sharing my screen. Okay. Well, actually, could I get, oh, here we go. Did I do it right? Maybe. Hopefully it's sharing. So starting with the reserve depletion date, this is what garners all the headlines every year, and many of them are very alarmist. So for over a decade now, the trustees have been projecting that Social Security's trust fund reserves are, oh wait, I know, I see, I didn't actually press the share button. Okay, now hopefully that's what, did that work? Maybe. Okay. Sorry, back to
You got it.
Okay, thank you. I'm so bad at this. So for over a decade now, the trustees have been projecting that Social Security's trust fund reserves are going to be depleted sometime between 2033 and 2035, as you can see in this red box since I finally shared it. This year it's 2034, so right in that range. Many years there are fluctuations for two major reasons. One is that the actuaries are always working to improve their methodology over time to their great credit. And the other is that predicting the future is really hard. So they have to tweak things as things change, like pandemics and recessions and inflation and all kinds of other factors that change over time. So the same thing is true for Social Security's long-term financing gap. I'm going to put up another version of the chart that Mark just showed, assuming I can, oh God, sorry, I'm so bad at this. Okay. Oh, there we go. Yeah, it did it. I've been looking at versions of this chart again for 20 years, and they all look the same. The cost of benefits climbs as the baby boomers reach their peak retirement ages. We're in the thick of that right now. Then the cost line plateaus. That's mostly because the boomers were born in an era where large families were the norm. So we've got that big generation going through the pipeline now. The generations since then have averaged about 2 kids per family, and that seems to be the case, over the long term. So costs are staying pretty much the same. This is not a program that is growing out of control. Look at this graph, it's fairly flat over time. Meanwhile, the program's income, which mostly comes from the 12.4% payroll tax, stays flat. For the next decade or so, Social Security's trust funds are going to make up the difference between benefits and taxes, and then the two lines diverge and the gap emerges. That's the problem that we're all here to talk about. Andrew already talked about this a little bit. Measured in terms of taxable payroll, the gap this year is 3.42%, which tends to increase over time because each year, the 75th year is another big deficit year that's added to the 75-year window. So again, that's not really a surprise. But while none of this is surprising, it is a problem. Why? Because people love Social Security. They rely on it. It accounts for about half of income for the median retiree and much more for lower lifetime earners. People are really worried about what's going to happen to their benefits when the trust fund reserves are depleted, especially young people. And people have been telling us for a long time that they want policymakers to prioritize securing Social Security. Now let's see if I can, yeah, I did it. So for example, this is Pew polling from the last election. Securing Social Security was the public's 5th highest priority. This really flies in the face of the idea that policymakers should be afraid of addressing Social Security's finances. In fact, the public is eager for a fix. But what they really don't want is benefit cuts. Social Security benefit cuts are deeply unpopular. That's true across party lines. That was most recently demonstrated at the State of the Union this year, where even people who have proposed cuts loudly backed away from their ideas. It's also evident in polling for a long time. So here's some recent polling showing that, again, across party lines, people oppose cutting benefits. Lest you think this is about people wanting a free lunch, it's not. People understand that Social Security is either going to have to spend less or, spend less or pay more. They know that. And when people are asked whether they'd like to pay more or get less to fill the financing gap, the results are perfectly consistent with what Pew found here. They'd rather that we raise taxes. Yes, I said it, raise taxes than cut benefits. And I think policymakers would do really well to listen to them. So that's it. Thank you.
Richard, you are up.
Thanks a lot for having me. Glad to be here. Let me start off with some basics from the report. As Mark mentioned, the trust fund exhaustion date is now 2031, according to the CMS actuary, which is a gain of 3 years over the 2022 report. The CBO baseline, in contrast, has an exhaustion date of 2032. Now, the improvement comes largely from lower than previously projected Medicare spending and some improved revenues according to the OACT projections. The revenue gains are due mostly to gains in employment and wages, including expanded immigration. The CBO, in contrast, attributes gains largely to or more to revenue gains. Now, the report acknowledges the growth of the Medicare Advantage program, much as Mark noted, but it offers very little insight into the role that the Medicare Advantage program potentially has in either diminishing the trust fund or potentially helping to improve matters for the trust fund. Now, Part A payments account for about 42% of Medicare Advantage spending. And so that's something to kind of hold in your head as you think about this. So there is good news, but as Mark noted, we should not be doing a happy dance quite yet. We are either 8 or 9 years away from a day of reckoning. So making good policy choices today will hopefully ease the ability to address the problem as the pressure on the trust fund grows. Recall that we're looking at something like a cost over revenue difference of about 300 billion over the, north of 300 billion over the next 10 years. Now, I do think we should be wary of forecasts, and so either good news or bad news that we get from these reports and our celebration of them have as much to do with the forecasts and how good they are and how they're changing as they do with the underlying economics of the program. And I'm especially concerned about sort of some of the 25-year projections, which, could be wildly off either on the plus side or the minus side. And the CBO letter recently to Senator Whitehouse is a case in point. Now, I think there are some important lessons that come as we think about a solution to all this, starting with the letter that Paul Spitalnik, the chief actuary at CMS, wrote about the potential impact of the Biden budget on the trust fund. And the lesson there, I think, is that making small to medium-sized changes can significantly affect the trust fund's life. And both revenues and spending changes can improve matters greatly. So, for example, one of the proposals that many have floated is increasing the net investment tax rate, increasing that tax rate, expanding the base and shifting it from the general fund to the trust fund. And that would dramatically improve matters. The base could be expanded simply by eliminating exemptions such as those on subchapter S corporations and limited partnerships. I also think that putting quite a bit more attention to the Medicare Advantage program in a variety of ways could help. Understanding the payments to special needs plans, reforming the quality benefit program, quality bonus program, fixing some of the broken risk adjusters along the lines that have just been proposed in the notice and then the rate letter, and then adjusting Medicare Advantage rebates that appear to be shifting savings from Part A to Part B. And then as the budget proposal from the Biden administration points out, you could get some additional prescription drug savings, particularly from Part B, and those could be used to move support into the trust funds. I think that acting now is important in it, beyond just trying to ease the trajectory. It's important because we're at a sort of demographic knife edge. We're at a point right now where we have downward pressure on per enrollee spending because we're getting an influx of younger, healthier people into the Medicare program. But we are soon going to be in a different demographic position where the age-specific growth rates suggest that we're going to be getting into higher rates of dementia and other disabling conditions, in part driven by obesity and some other health concerns. Projections by Rand and others indicate that rates of obesity and disability are likely to increase in older adults that are Medicare beneficiaries. And so really the time to act is now, because whatever tailwinds we're facing are going to disappear pretty rapidly. I'll stop there.
All right, so I think that's me next, right, Josh? Okay, well, I'll just go ahead and share my screen. I've got one slide to show, which pretty much says most of what I want to say. Appreciate the opportunity to participate. But just to start with some overall highlights from the reports, I certainly think it's good news from a financial perspective that the lower spending and higher income of the past year than what was expected has given policymakers a little bit more time to deal with the issue of hospital insurance trust fund solvency. But it's important to note that we should not count on these kinds of developments with every new report. Relying on economic changes and changes outside of healthcare policy is not really a substitute for the policy changes that are needed to bring the trust fund into a more stable place. And so the trustees have noted in this report that it's important to have a sufficient balance to deal with different contingencies. One of those contingencies could be a recession or other smaller changes to the economy over the next decade that could put the trust fund in an even worse position. But moving to the other portions of the trust fund, of the trustees' report, the solvency number certainly is the piece that gets the most attention. But as Mark noted at the beginning, Part B is the fastest growing part of the Medicare program in terms of spending. It's growing, it accounts for about 2/3 of the growth in program spending over the next decade. And that comes from a completely different trust fund. That comes from the Supplemental Medical Insurance, SMI, trust fund. which does not have the same solvency issues as the HI, Hospital Insurance Trust Fund, but it still does have fiscal challenges associated with it. So the chart that I'm sharing here, it shows the funding sources across the entire Medicare program, across both the HI and the SMI Trust Fund. And you can see that payroll taxes, that is the primary source of financing for the HI Trust Fund. That's the revenue that we're talking about that deals with solvency. And that is shrinking as a share of financing. Part of that has to do with the solvency date, and it's shrinking relative to expenses. But at the same time, Part A, as a portion of program spending, is also shrinking along with it. By contrast, general revenue, the big orange line at the top, is growing as a share of Medicare financing. That is the biggest source of funding for the SMI Trust Fund. And what this means is that Part B, particularly from its growth, and Part D, those are the benefits that go into the SMI Trust Fund, are going to be more reliant on transfers from the rest of the federal government. And this means crowding out other federal priorities and contributing more directly to the federal debt despite this trust fund financing. And this increasing reliance and over-reliance on general revenues from what was previously a more or less self-sustaining program actually is the reason why this is the 5th consecutive report in a row for the trustees to issue a funding warning to the president. So talking very briefly about policy options, I know we'll get more into this in the discussion, but given the fact that Part B spending and SMI spending is going to take up more tax revenue, I think it's going to go from 13% this in 2022 to 22% of all federal income tax revenue by 2030. So over a 5th of federal income tax revenue, both individual and corporate, will be going to this trust fund. Given that growth, what are the policy solutions that we should be pursuing? At Paragon Health Institute, we recently released a paper a few weeks ago called Turning the Tide on Red Ink, which we wrote not specifically to talk about the HI trust fund solvency, but we instead focused on reforms across the different federal healthcare programs because we do believe this is a systemic issue to solve. And we specifically focused on areas including Medicare proposals that don't change or reduce benefits, don't raise taxes, and have had bipartisan support in the past 10 years. So these are ripe areas for policymakers to start their reform efforts. In terms of the proposals in that paper that would address the HI Trust Fund, there are about 5 of them total in our paper. Those would total over $300 billion over the next 10 years in savings to that trust fund, which would cover the shortfall that Richard mentioned, and would be a good starting point for more systemic reforms, since these are the ones that both parties have supported in the past. They include things like site-neutral payments for post-acute care facilities, reforming Medigap plans, reforming uncompensated care payments in Medicare. And so we think that those are good places to start. In terms of longer-term spending trends, one interesting fact from this report, when it was analyzing why Medicare spending has been growing less slowly than expected in the past few years, one of the factors cited was that hip and knee replacement procedures were switching from inpatient hospital settings to outpatient and ambulatory settings, which seems like a very specific niche area of healthcare services, but it's actually represented very concrete policy changes. CMS under the Trump administration had removed regulatory restrictions to deliver those services. Previously, they could only be delivered in inpatient settings, but by shifting those to less costly settings, they've been able to provide more value to patients and to the federal government. And these are the types of flexibilities and innovations that we should be seeking throughout the Medicare program. The model of having our healthcare service delivery system focused on inpatient hospitals is a little bit outdated. That was the most relevant form of service delivery at the beginning of the Medicare program. But since then, it's become clear that outpatient and ambulatory settings can deliver good value for lower costs. So These are the types of reforms that we should be looking at in the long term, and not only with the focus on Part A and the hospital insurance solvency. That's certainly an important issue, but the fiscal sustainability of the program as a whole.
Okay, thank you, Joe. And thank you, panelists. So we're getting a lot of questions from the audience, but I still encourage everyone to send in their questions using the question and answer function on Zoom. And let me start off with a question. I like to start with this question because it's a little bit more positive. These things tend to get negative, and we all get frustrated with the delay on policymakers dealing with these issues. So the question I like to start with is kind of one of the things that we like to highlight when we talk about trust fund solvency is that fixing these trust funds and knowing when these insolvency dates are helps us think of ways to get Congress and the president to focus on making some changes. And the trust funds are just accounting devices. So I like to think of ways that we can improve trust fund solvency, but also improve the underlying program. So I'm going to ask each of you whether you can think of one solvency improvement that would also have a big impact on making the actual program better that you're going to talk about. So if anyone wants to start, because I'm springing this on you, I can then direct who answers after that.
I can start if you like.
Sure.
During my presentation, I mentioned that the maximum benefit from Social Security this year is about $43,000. I wrote a piece in the Wall Street Journal a month or so ago where I made a very modest proposal. I said, Congress should simply cap that maximum benefit. And this, because under current law, that $43,000 maximum benefit is going to rise to $59,000 by 2050. And just say, look, $43,000 is enough. It's far beyond what anyone needs to stay out of poverty. And just cap it at that. Now that might get you 10 or 15% of the long-term gap, something like that. It's not a real fix, but it gets you something by trimming benefits for a group that very clearly doesn't need the benefits, that very clearly already has the highest retirement incomes of any place in history, and just sets a principle. There should be some limit on what these programs should pay. So it's a modest fix. Somebody might call it a gimmick, but I think it gets at a principle that actually matters of thinking how much more we want to pay to middle and upper income people.
All right, Kathleen, should we just keep on Social Security and go to you?
Sure. So a Social Security improvement. Well, Andrew and I actually have talked a lot about how to improve Social Security for lower lifetime earnings. We both think about that a lot. We also think about people who don't get Social Security at all, because those people have the highest rates of elderly poverty. So I think since for the last 20 years, there's been kind of one go-to minimum benefit proposal out there that's a sliding scale based on years of work that honestly does not move the needle very much on elderly poverty. And so I think, one thing that I would be really interested in is for, I'm in fact working on something to look at different alternatives to that, to how to reduce elderly poverty through Social Security and outside of Social Security, beyond that sliding scale minimum benefit that has become a feature of practically every Social Security reform proposal from Bernie Sanders to Paul Ryan. And I'm looking forward to, we do have some time to think about this. I'm looking forward to talking to people across the political spectrum, because there is interest in this across the political spectrum, and to thoughtful people like Andrew about how to really improve benefits for lower earners.
All right, Richard, you want to take a stab at it?
Well, I do think that putting a lot of focus on the Medicare Advantage program for a couple of reasons. I think that that is more of a reflection of what the modern healthcare system looks like. And it's also a place where we've as a matter of policy, kept our visibility into the workings of the program to a minimum. And so I think there are some opportunities there to really make some changes in sort of accountability and payment that would go a long way towards both fixing the overall program and the future of the program, as well as dealing with the solvency issue.
For my part, I think post-acute care site neutrality would be a good specific proposal for the Part A program and for the HI Trust Fund. Site neutrality in general, I think, is a good idea across the program, and we have a few proposals in that turning the tide on red ink paper I mentioned before, which would yield benefits throughout all of the Medicare program. But in terms of this particular focus on post-acute care, right now, traditional Medicare has several different payment systems for different types of post-acute care facilities. The result of that is that two Medicare patients going into two separate facility types, even if they have similar health status or have similar healthcare needs, Medicare is obliged to pay one facility more than the other simply because of the site of service. And this has led to overpayments over the years, as organizations like MedPAC have found consistently. Within the trustees report, we see that skilled nursing facilities and home health agencies, those are two of the post-acute care facility types. Those are the fastest, those are growing faster in terms of spending than inpatient hospital spending, which is kind of what most people think of when they think of the Part A program. So this is definitely an area ripe for reform, and simply consolidating those payment systems into a single payment system that pays based on the health status of the patient rather than the site of care, and adjusting those payment updates in a fiscally sustainable manner would save the Part A program about $75 billion over 10 years, according to CRFP scoring.
Yes, I should put in a plug for our recent work on site neutral payments, which you can find on our website. All right, let me talk a little bit about taxes. We're getting a lot of questions, as I'm sure the Social Security experts can imagine, on the tax cap and other options to raise revenue to help with the Social Security imbalance. And one question that may be worth everyone answering is, the question is, are we, like, through just using payroll taxes, should we be thinking about revenue from outside payroll taxes in order to support Social Security? And I know there's a historical reason why we did that. So maybe you can kind of cover both the historical reason and maybe your thoughts for the future of Social Security revenue. Kathleen, do you want to start?
Sure. Well, for one thing, I think I was very struck in Joe's presentation. What a nice graph that he put up. I love a good graph, but that, you know, Medicare financing is not solely based on payroll taxes, not even close. That, you know, the biggest share of revenues there come from general revenues, and even the payroll tax in Medicare is structured very differently from that for Social Security. For those who don't know, the Social Security payroll tax is only levied up to $160,200 in income, or I'm sorry, in wages, and then it stops. For Medicare, there's no cap, and not only is there no cap, there is even an additional payroll tax for higher earners, and on top of that, we have the net investment income tax. That, you know, it's a little complicated how that financing works, but it basically mimics the addition, you know, the total Medicare tax, and it applies it to investment income for higher earning households. So there's no reason that a social insurance program has to be funded solely through payroll taxes. There's no reason that it has to be only on, you know, below a certain threshold. And in fact, Medicare shows us that it can be very different, and that we can tap higher earners and people with higher wealth a lot more than we are doing now. And so I would be very receptive to ideas along those lines for Social Security. But like you said, the history is different. You know, Social Security has always had a capped payroll tax. And the idea is that Social Security is replacing some portion of workers' lost income when they retire, become disabled, or die. And it only replaces income up to that cap. And so, the idea is you don't necessarily need to replace, all of, say, a millionaire's income. You just need to replace up to a certain amount. And that's true, but it's also a progressive benefit formula. And so, at the top bracket, so to speak, for Social Security, about 15% of earnings are replaced. If you did increase the cap or even eliminate the cap, you could make that like a much smaller percent replacement as well, and still maintain the link between benefits and earnings, and still not be giving people outrageously big benefits. So that's but again, I'm very interested in increasing revenues and increasing tax income into Social Security.
I can, obviously this gets talked about a ton with Social Security, and people are saying, why don't we just eliminate the cap? That'll fix our problem, blah, blah, blah. And I can kind of go a couple different ways on it. If you ask, or if you wonder why it is so difficult to cut Social Security benefits, it's because people have this perception, I earned those benefits, I paid for them. It's this fairness thing. It's not necessarily an argument over need. It's for a lot of people, even middle or upper income people, it's a fairness issue. The cap on payroll taxes, which was deliberate from the beginning, contributes to that, in the sense of Social Security is redistributive, but it's not wildly redistributive. It's not a welfare program. If President Clinton back in the 90s talked about this, he said, look, if you have people at the high end who are paying, multiples more into the system than they're going to receive from it, that changes the nature of the system. So if you're a traditional defender of Social Security's earned benefits and all that stuff, there is a downside to uncapping the payroll tax using general revenues or whatever. At the same time, there's an upside to it. If I look at a system like Australia, which has a higher minimum benefit than the US, a true protection against poverty and old age, but caps that at a much lower level than we pay benefits, they finance that by general revenues. And I'm fine on that, because that says we're going to have a progressive source of revenues. We're going to have a very progressive benefit, but it's going to be limited in cost. At some point you run out of money. And the way I would put it is this, and I'm right of center, so one of my opinions matter. But if I were a progressive and I had this whole laundry list of things that I wanted to do, and the only way to fund them is by higher taxes on high income Americans, Social Security wouldn't be what I would use it for. Because if you listen to Kathleen and I, we're both concerned about protecting people at the bottom, about having better protections against poverty, better social insurance. The question on the higher taxes for high income people is, are we going to have higher taxes on high income people to pay higher benefits for high income people, or are we not? And if I were thinking about, I want to have Medicare for all, I want to have free college, I want Green New Deal, or whatever it is people want, if you uncap the Social Security payroll tax, that's effectively a 12 percentage point increase in the tax on the high end. That's all you wrote, folks. You're not going to get that, to be honest. But if you get that, you're not getting more than that. We're not raising taxes on high income people by more than 12 percentage points. What that means is all those other things you'd like to use that money for are gone, because you're using this. We pay $42,000 a year to high income people. So I just think we want to think about this not just in isolation, but think about the role the tax plays and the other uses for that money. So I'm open to using other sources of revenue. I just don't think you want to use other sources of revenue and pretend we still have this system of earned benefits. We're all in it together. It just that doesn't hold together conceptually. So, but I think there are some opportunities there. I'll just say that.
All right, thanks. And let me stay really quickly on the revenue thing. Richard, I wonder if you mentioned the president's budget basically wants to extend Medicare trust fund solvency for about 20 years, largely through tax increases. So I wonder if you wanted to kind of add a little bit to this discussion with that in mind, the best uses of the revenue. If we're raising revenue, should it be going to trust fund solvency? And maybe if you could really quickly say whether there's something the president missed in his push for revenue to do solvency that you think would be a good proposal to think about in addition to the things he did. And then Joe, you can quickly answer if you have any thoughts on the president's submission and about revenue for Medicare.
Yeah, let me just, even though I'm not a Social Security guy, I thought that Andrew's point was just exactly right in terms of needing that that above the cap money to do a lot of other things that are going to be taken that people are going to go after for other reasons. So I think that's an important point. I think in the thinking about the Medicare side of it, the big thing here is that the NIIT, you can get a tremendous amount of traction for the trust fund just by moving it, because right now it's a general revenue thing. And so if you are just worried about getting an infusion of new money, you can do that just by shifting where the money goes from the general fund to the trust fund. And it's easily because it's particularly easy to do that because right now the way the NIIT is set up, it's in that part of the IRS code that is about the trust funds and the Medicare program. And so, it's an obvious place to do. Now, I think the points that Kathleen and Andrew made had to do with some, in a sense, was what does the base really have to look like? And I think that one of the issues here across both programs is that when they were designed, wages and earned income were a completely different share of total income than they are today. And so, in fact, if you want to sort of go after income in a comparable way, you have to sort of expand the base. And I think that to some extent, the president had some opportunities to make small changes there, particularly on some of the exemptions that weren't fully articulated. And I think those are opportunities to get some real money into the trust fund and still not be sort of moving to that type of territory that Andrew was pointing to that you might want for other things.
Yeah, with regards to the president's budget request, it seems like the revenue provisions of that did a lot of, they did almost all the heavy lifting for with regards to trust fund solvency without really any underlying changes to the spending in Part A. And that's my qualm with it, is that relying too much on shifting revenues from the general fund is something that, it doesn't really address the underlying issue. I think that stopping the overspending in the first place is better than trying to find new ways to pay for the overspending. So that would be my biggest qualm with it. I think kind of with regards to your previous question about what if we had more revenue for Medicare coming out of the general fund. You saw the chart that I shared before. If you want that, the good news is you pretty much already got it. And I think that when you start shifting around these revenue sources throughout the budget, while it might on paper deal with the issue of solvency as an accounting matter, but there are longer term trends that I think are imperative to address. And we need lawmakers to focus on that and on the costs overall, rather than just focusing on solving one accounting problem.
So that's a good leading into my kind of final wrap-up question here. We thank everyone for coming and submitting their questions. And in a fair amount of the questions, you sent some sort of futility that policymakers won't actually get to doing any of this. And we had a really kind of weird debate at the beginning of this year through now on what things should be taken off the table. And there was the State of the Union thing and debates about what counts as a cut and what doesn't count as a cut. And So it makes me wonder what we see, how we see our way through this, because what all of those debates kind of try not to say is that those cuts are coming if no one does anything, right? That's really what the message from the trustees is, that when those trust funds become insolvent, across the board cuts are going to happen if policymakers don't step in to do something. So I guess I'll ask you all quickly, how do you think we get from here to there? And what are kind of the prospects? What do you think is going to happen? How much of this debate over the first part of the year is usual stuff versus unusual and concerning? So we will have that be the last question, and I'll start with Joe and go back through the order.
Thanks, Josh, and I appreciate the opportunity to participate in the panel. I guess I'll just plug again our paper, Turning the Tide on Red Ink, because it kind of specifically gets at that question of how do you make Medicare reform and healthcare reform palatable. We set out to look at solutions that have had bipartisan support. And I think you're right that there's always a debate about what counts as a benefit cut. People don't want to feel like they're paying more for their healthcare, more than they already are. Health costs have been increasing to tremendous heights, and to ask for more is tough for them. So I think that reforming payment reforms and finding more innovations and flexibilities in the program can cut costs without hurting these benefits. And if we do so sooner, then we're not going to need to have that pain on beneficiaries.
Richard?
Yeah, I certainly agree with the idea that we need to rein in costs. And again, I look at the places where we've had less visibility and less strong policy making. And in terms of the government's toolkit, I would say that the Medicare Advantage program is a big part of that. I get a little nervous about some of the other cuts only because those then flow into other programs. And I was, I think there's a lot of room for some provider cuts. I think the bad debt part that I know that you all have been proposing is a good starting place. But I would go along with, for example, post-acute restructuring, but I think you need to be very mindful of what happens on the Medicaid side, because right now, long-term care in this country is largely paid for by Medicare cross-subsidizing Medicaid. And so if we want to sort of fix the whole thing, I'm good with that. And I think we could do it in a way that saves money. But I think that is less straightforward than some of these other things.
Kathleen?
I think, well, we've all been saying it would be better to act sooner rather than later on Social Security. Like I said, we've been having the same conversation I have for 20 years. Andrew's been at it for longer, and we've all been saying that. I do think that. I think it would be better for people to be less anxious. People are really anxious about, is Social Security going to be there for them? It would be better for people to plan. I think it's important. I think it's good. But I'm also, skeptical that Congress will act before the 11th hour. Andrew and I had a back and forth on Twitter about this last week. I'm skeptical. I'm not sure that we're going to get through this year without a default or a government shutdown. So I certainly don't think we're going to, come up with we're going to pass legislation on Social Security this year. That said, I think there's been a lot of pretty productive conversation over the last year about Social Security. And I think, there have been, for example, the bipartisan Senate working group, they've floated some twists on old ideas and new ideas, some different things, and it's gotten people talking. And so I think even if we don't have legislation right now, we can use the next 10 years productively. We can we can develop new ideas, we can discuss things, we can figure out where people are and where the areas for compromises are, new ideas. And so I think we can, do our best to use the time as well as we possibly can.
Andrew?
Well, it's nice to be last because I get to play off what everybody else has said. Joe and Richard's comments on Medicare, their whole discussion is very interesting for me of contrasting Medicare and Social Security reform. And in a sense, Social Security looks easier because it is the smaller problem. Generally, smaller problems are easier to solve than larger ones. At the same time, though, there's very little scope for like what Joe talked about. Well, if you change one regulation so you can do hip replacements, outpatient rather than inpatient, that can have a meaningful effect on the program as a whole. There's very little room for that within Social Security. It is a cash in, cash out program. There's very little room for efficiencies in the sense of, Medicare protects more efficiently, you can get more for less. Social Security can't have that. The only way we can avoid having more going into the program is have less going out. And people see that in their checks. It's a very salient issue for them. And that's, I think, part of what makes it very hard. Another part, I think, and there's been a lot of talk about trust funds here, is the US is unusual in having this trust fund structure for its retirement program. Most countries they don't think about this stuff. The trust fund, I think, makes it harder because A, people think they earn their benefits, which, to be frank, most of them didn't. But B, if you say it's solvent until 2035, people are like, well, let's just wait till then. And I agree with Kathleen that we don't want seniors, people approaching retirement, to feel anxious about it. I wouldn't feel bad if a member of the Congress felt a little bit more anxiety about it. I mean, your average member of Congress today is far less well-informed about Social Security than somebody 20 years ago. I mean, it's reading off 3x5 cards. It's very little knowledge about how the program works in a mechanical sense, much less how it fits in with the overall environment of retirement security. What we see from our political leaders today, I'll just say, is not serious. It's, there are leading presidential contenders on both sides have basically said, we won't cut benefits in any way, but have almost mathematically ruled out the things that would allow them to pay for that. And so it's, it really is, I hate to be a downer, but because we all try to be positive, but if we look back over the past 40 years, we've known this thing was coming. And in those periods of time, other countries have reformed their retirement systems 2-3 times. We haven't done anything on it. And so I am honestly much more concerned about a hard landing than a soft landing, because I don't see the level of seriousness. For all the talk of, this is a sacred trust, people have earned their benefits, et cetera, nobody's acting as if that's something they've got to take seriously. And so I'll just be honest and say I'm worried about how this thing plays out.
All right. Well, thank you to our panelists. Thank you to the audience and for sending in all your questions. And we look forward to seeing everyone again soon for a Committee for Responsible Federal Budget webinar later on. Thank you so much for joining us.